Hi everyone, Braden Guy here. Today I'm going to talk to you about lower back pain. Specifically, I want to talk about lower back pain that you might feel when you wake up in bed in the morning. Or if you've been sat all day and you're standing up, the lower back pain you might feel then. Or generic aches or toothache kind of sensations that you might just feel across the lower back. One common cause of the aches and pains that you might be feeling is something called anterior pelvic tilt. So when we talk about anterior pelvic tilt, we're talking about anterior, meaning the front side, pelvic tilt. Which means if the pelvis is tilted forward, perfect, we get an exaggerated curve in the lower back. A few things may be causing that, and I'm going to explain those to you now. So when we look at the front side of the pelvis, there's a few things that I want to consider that might be causing this anterior tilt. One is the rectus femoris. The rectus femoris joins to the top part of the tibia, just below the knee, and to this lumpy bit in the pelvis just here. So if this rectus femoris gets tight, this, which attaches to this bone here, can pull down, causing anterior pelvic tilt. Secondly, we've got the psoas muscle, which is a hip flexor. This attaches to several lower lumbar vertebrae and to the medial portion of the upper leg. Thirdly, we have the erector spinae. These go the whole length of the spine and attach to the top part of the pelvis just here. Now if these are tight, these can be pulling up. Rather than pulling down like the muscles at the front, these ones can be pulling up. So if these are tight, these are going to cause anterior pelvic tilt. So those are the muscles that are tight with anterior pelvic tilt. What about the other end? What about the muscles that are weak? We could have the lower portion of the abdomen not turning on, which is causing anterior pelvic tilt. So if this part here across the waistband is weak, that is going to be causing a drop. Another weak muscle could be the glute maximus. The glute maximus causes leg extension, and if this is weak, this can also cause anterior pelvic tilt. Now I want to show you some things that you can do at home to see if you've got this anterior pelvic tilt, if this is what's causing the discomfort in your back when you're waking up in the morning or when you're standing up from sitting down for long periods at a time. The first thing I want you to do is lay on the floor. Just lay, relax, don't do anything special, and then slide your hand underneath your lower back. If you can't get your hand any further than this first portion of skin, that's great. You're probably not anteriorly rotated. If we anteriorly rotate, fantastic, and you've got this big gap right underneath here and you can get your hand all the way through, then that's probably anterior rotation. Now the lower back doesn't have to specifically be touching the bed, we just want to limit that gap in there. The next test I want to do is called the Thomas test. Now what I want you to do is find the edge of a bed or something nice and firm like this that you might have to lay down on. You're going to scooch to the edge of the bed for me. Fantastic. You're going to grab one knee, pull it right up to your chest, and then just lay down flat. Let the other leg relax. Fantastic. If this leg here is touching the bed, hip flexors should be okay. So if this was a positive test for tight hip flexors, this would be raised off the bed, like this. If you had a tight rectus femoris, this leg would be straightened out a bit further like that. But we're doing okay here. So now we know what a hip flexor is and if it's tight or not. This is going to be my hip flexor and I'm going to explain to you how sitting for the majority of your day might be giving you back pain. So the hip flexor connects to the lower back, just in here, and to the front of the leg, just down there. If I sit for the majority of my day, I'm encouraging this muscle to become shorter and tighter. Then if I want to stand up, this muscle gets longer and it doesn't like it. So what it tries to do is pull the lower back through with it. This can cause anterior pelvic tilt. Although this muscle isn't directly connected to the pelvis, it is a huge cause of anterior pelvic tilt. So now we've got tight hip flexors, this is what I want you to be doing. It's just a very basic, simple hip flexor stretch. So now we know if we do or do not have tight hip flexors. If we do have tight hip flexors, this is going to help. First of all, I want you to get something nice and soft to kneel on, like a yoga mat or a pillow. Then we're going to kneel down, we're going to do a lunge. What we're looking for here is a 90 degree here and a 90 degree on the front leg. When we're in this position here, once we're in this lunge position, what I want you to do is go into a posterior pelvic tilt. That is squeezing the glutes and tensing the lower abdomen to rotate the pelvis backwards, just like that. When we do this, we should feel a nice tight pull at the front of the leg, just there. This is your hip flexor stretching. Once we've done this, we can now lunge forward about 2 inches. Go forward for me. We don't have to go all the way to the floor. This is plenty to stretch the hip flexor. Just relax the pelvis for me. I'm going to go into anterior pelvic tilt. Fantastic. Did that make that a lot looser here? So going into anterior pelvic tilt makes this a lot looser, which means you can go a lot further. That's not the point. The point is to stretch this hip flexor. So going into posterior tilt again for me, Em. Fantastic, and we can feel this stretch at the front here. Bro, I want you to hold this for around 10 to 30 seconds, depending on what you can do. Up to 2 minutes if you can manage it. If that hip flexor stretch was a little bit too difficult for you, which it might be for some, I've got a much simpler version for you. All we're going to do is lay down on your bed. We're going to shuffle right to the edge till one of the glutes is almost hanging off of the bed. Just like this, and we're going to bring this leg off and let that dangle down. You might want to hang on to the other side of the bed to not fall off. So with this here, we've almost got the same stretch on that hip flexor here. So we're practicing the pelvic rotation a little bit. So we're keeping control of the pelvis here. We're not completely flopping. We're trying to keep hold of the pelvis a little bit while feeling a stretch down the front of the leg here, mainly in this hip portion just there. This one is something that you might not feel straight away, and it might take about 10 or 15 seconds before you start to feel a stretch. Keep that stretch on for about 30 seconds to a minute, 2 minutes, depending on what you can handle. So if it isn't your hip flexors that are tight, and it's not that that's causing lower back pain, here's a quick snippet of a little tension release for the lower back that we can do. I will be doing another video on tight lower back muscles, so keep an eye out for that one. We're going to get ourselves a tennis ball or a lacrosse ball or something similar. We're going to put it on the lower back. What we want to do is try and find that pain. We're staying away from bone here. We're going to locate a tight spot, then we might try and wiggle around on top of this ball. So we might try and just moving the lower back, going into anterior, posterior pelvic tilt. We might even try and lift the leg, bring the knee to the chest to really put some pressure down into that ball, really get into those deep muscles and grind those tight parts out. Thank you so much for watching, guys. I hope this video has helped. If it has helped you at all, please consider giving me a thumbs up and subscribing to my channel. Every little bit helps. Like I said, I'll be doing plenty more videos on all these nitty-gritty bits. If you've got any questions or any bits that you'd like me to cover in the future, please leave them in the comments below. Thanks for watching, guys, and I'll see you next time.